This is a short video presentation on alcohol consumption and its consequences. As you know, most people tend to celebrate success or events, drinking alcohol, some low quantity, or there's a high volume. And as a result, over time, an individual who participates in this ends up with many consequences of alcohol consumption, even though it is seen in the society as just a social activity to entertain yourself. Alcohol is deadly. Alcohol and cigarettes, in my opinion, are two of the most deadliest poisons known to man. But because there is economic value in them, the governments tend to minimize the effect of alcohol knowledge to people. There is no perfect level of alcohol intake. So when somebody says, I only drink one glass, sad to tell you that even one glass of alcohol in a day or every other day actually presents a cancer risk to the breast of a woman. So alcohol is a carcinogen and is associated with many cancers, such as cancer of the mouth, cancer of the throat, which we call the pharynx and the larynx, cancer of the food pipe, which is the esophagus, cancer of large intestine, cancer of the rectum, cancer of the liver, and of course, cancer of the female breast. The whole body is impacted by alcohol, starting from the brain to the gut, to the pancreas, lungs, heart, blood cells, immune system, and etc. Alcohol contributes to more than 200 health conditions. So if you must drink alcohol, the recommended amount is 1 drink or less in a day for a woman, and 2 drinks or less a day for a man. And what is 1 drink or 2 drink may vary from individual to individual. So I'm saying 1 glass of beer means 1 drink. A small amount of alcohol in a glass, when I mean alcohol, is like hard liquor, like gin, is 1 drink. The quantity doesn't matter in relation to whether it is harmful to the body or not. In the past, we used to believe that 1 glass of wine every day helps the heart to achieve a good health, but subsequent studies have demonstrated that that may not be the case. Alcohol impacts on your brain, and one of the ways I present the consequences and effects of substances is to have an individual stand in front of you. And so if you start from the brain, alcohol is associated with stroke. In fact, within 24 hours of drinking alcohol, you are bound to have its consequence, and it goes down as you metabolize the alcohol. Alcohol causes dementia, which is a form of memory loss, and causes you to have inability to think. And I'm not saying when you are drunk. Even if you're not drunk, alcohol impairs your ability to think. It also causes you to develop memory loss and also cognitive impairment, which means your ability to think. The brain cells that you use for thinking are impacted negatively by alcohol, damaging them. if you come down from the brain before you get to the eyes, alcohol actually, in association with impairing your ability through diet to get vitamin B1, which we call thiamine, one can develop what we call encephalopathy, in which the person becomes crazy, if I may use the expression. It's a combination of symptoms, and we group them to call it Wernicke's encephalopathy. And then there is a brother of it we call Korsakoff. So both of them join together, I call it a Wernicke-Korsakoff syndrome. And what it does is that it damages your brain, you are confused, your ability to maintain good gait when you are walking, in other words, walk with balance, you're going to be staggering because the portion of the brain that controls your ability to walk straight is impaired. In addition to that, it damages the nerves that supply your eye muscles. And then you have ophthalmoplegia, in which your eyes don't function because the nerves supplying them have been affected. When you go down from the brain and the eyes, then you get into the mouth. Alcohol causes cancer of the mouth. Alcohol can cause cancer of the voice box area, the larynx, and then the portion of the mouth we call the pharynx, going towards the throat. Alcohol is associated with this cancer. Then alcohol is associated with cancer of the esophagus, the food pipe, as well as the cancer of the stomach. If one escapes from this cancer, then you're going from the mouth down to the heart, the chest, where you have the lungs and the heart. Alcohol is known to cause hypertension. Alcohol is associated with an irregular heartbeat. It causes irregular heartbeat called atrial fibrillation, among others. Alcohol causes cardiomyopathy, which means the heart muscles are weak, they can't pump well, and so the heart fails. And alcohol can make you have heart attack. And this is over time. So when we go from the heart, then we get to the lungs. Alcohol increases your chance of having pneumonia repeatedly. And we know that a lot of alcoholics, by losing their ability to control themselves, some people, especially during the cold weather, aspirate. When they have something in their mouth, they don't know where they are. They can aspirate what they have in the mouth into their lungs, causing them severe pneumonia that lead to death. If we go from there to the stomach, alcohol causes the stomach to bleed. It's called gastric bleed. Sometimes it comes from erosion of the wall of the stomach that protects the blood vessels. So when you erode the wall of the stomach, then the blood vessels get exposed and then the individual starts bleeding. Some may end up developing an ulcer. Alcohol also causes pancreatitis, the organ that produces the enzyme that you use to digest your food, the chemicals you use to digest your food. One of which is called lipase, another one amylase, another one gastrin. Some of them are in the stomach, some will come from this other organ. When you have pancreatitis repeatedly, eventually the pancreas that produces insulin that you use in managing the sugar that come from your food, as well as what helps you generate glucose when you don't eat. And your body needs energy, so you have to produce glucose from where you store it in the liver and the muscle. That enzyme or chemical is called glucagon. Most of these are produced in the pancreas. So drinking alcohol destroys the pancreas over time, and the person begins to have inflammation of the pancreas repeatedly. Eventually, the pancreas will cease working efficiently, and somebody will develop diabetes. So alcohol intake is a known cause of diabetes. through destruction of the beta cells of the pancreas. Alcohol also causes the liver to be fatty. The liver has to have its architecture that is normal in order to do its job. The liver is the superhighway through which most of what you eat will go through before they get to your kidney, because the kidney is another superhighway. So when you get to the superhighway, the liver, and you have destroyed the liver with alcohol, it's not going to be able to detoxify the bad things that come from your food. And then you develop fatty liver, which means the normal liver cells will be filled with fat, and the fatty liver cannot function well, and you get sick. And over time, that fatty liver may end up degenerating straight into cirrhosis, in which the architecture of the liver is completely fibrosed, destroyed, and it has a lot of scar tissues, if I may describe it that way. And so it loses its ability to help you. And then the person begins to swell. Eventually, it leads to many complications, such as uncontrollable bleeding, inability to detoxify the food that come into your body. It will affect your brain. We call it as hepatic encephalopathy. So you are confused all the time, or you're sleeping all the time, and eventually it will kill you. Unless you have liver transplant, once you have liver cirrhosis, it will kill you. It's not maybe or maybe not. Then you have alcohol hepatitis, in which an individual, after you drink alcohol, inflames your liver cells, and then they begin to discharge a lot of chemicals, the enzymes that otherwise should be inside of the cells, performing the functions. They will leak out of the body all into the bloodstream and so on, and then it's going to affect the rest of your body. So it is a very deadly substance to the liver. If it's in excess, this damage forms very quickly and eventually kills the individual. Even if it's minor alcohol consumption, eventually, it may not kill you through cirrhosis, but it has many ways that it affects the health of a human person. We also have inflammation of the stomach, as I said, and then we have what we call gastroesophageal reflux disease, in which the junction between your food pipe and the stomach that is supposed to be tight to prevent food from coming back from the stomach into the food pipe, when it's loose, then you have both your food and acid produced in the stomach regurgitate back into your food pipe, destroying the walls of your esophagus or your food pipe over time, part of which can lead to cancer, or some may lead to strictures, in which swallowing becomes difficult. Then we can talk about the blood cells, how alcohol affects the blood cells. Alcohol can make you have anemia by suppressing the production of red cells in the bone marrow, or by making you bleed through the stomach, and you continuously losing blood, you become anemic. And anemia, if it's not treated, makes the heart pump harder, and when it's making the heart pump harder, the heart gets weak, and the heart may eventually fail. Alcohol can also suppress your white blood cell that you need to fight off infections. Alcohol can suppress the number of platelets, which is the type of blood cell you need to clot yourself. If you are cutting anything and by accident you cut your skin and you start bleeding, the body is equipped with this cell called platelets. They are supposed to come to that site and form like a mesh, like grapes in a bunch, to plug the site that is bleeding. So when alcohol depletes the platelets, when you have any small bleeding site, you can bleed heavily. In some cases, you can bleed out and you actually die. So when you have low blood platelets, even when you brush your teeth, you may start bleeding from your gum. We know that bleed from the gum, most often than not, come from bad mouth hygiene, in which you have bacteria causing you inflammation of your gum, called gingivitis, but that's separate from this. alcohol affects the endocrine system. And the endocrine system deals with a whole lot of glands producing the chemicals and the hormones that we need. Again, if you destroy the pancreas that produces the insulin that you need to manage your sugar, then you develop diabetes. The way you manage your cholesterol, the good and the bad, to balance up so that you have good health, alcohol can affect that. Alcohol can affect the function of the thyroid. Alcohol can make your red cells get bigger. We call it microcytosis. And the alcohol impairs your ability to use vitamins that come from your food. And so when you have deficiency of certain vitamins, such as vitamin B12, for instance, you will develop, again, dementia, which is inability to think and inability to remember things. Okay? So alcohol basically impacts every organ and every system. And then this is just a mere summary. And the alcohol equally affects your skin, because your skin is a defensive organ that protects you from the environment. So when you are drinking alcohol, it tends to dilate the openings in your skin and you lose heat. That makes you, if you're in the cold environment, to become hypothermic, in which you develop a low temperature that is going to impact how your body functions. Alcohol also is known to cause disinhibition, in which an individual, it acts like a fool, because when you are not in control of your capacity to think, sometimes you act in manners people would know that this is not appropriate for somebody your age. Okay? Alcohol in excess can cause you to be depressed. And when you become depressed, then you drink more alcohol, thinking that if I drink more alcohol, I'm going to feel better, and you go deeper into depression, which may sometimes lead someone to commit suicide. So in summary, I can say unequivocally that alcohol is not good for the body, and that no perfect safe level of alcohol intake is known by anyone. So if it's possible for you to stay away from alcohol, do the best you can to do so. It will make you achieve better health. But if you cannot, then do your best to drink as little as possible. Gathering in one location and drinking all these tons of alcohol people are bringing to funerals, bringing to wedding as a means of showing love is deadly. And if you look at the death rate of people these days compared to what it used to be, it will become obvious to you that there is something wrong. And when we say that people are dropping, they have sudden death, and we're always thinking, oh, it's the heart, or it's the brain. It's not always the case. Most illnesses don't start in one day and kill you on that day. A lot of illnesses start years and years and years until one day you actually drop dead without any warning. And when you start wondering, you say, oh, he has a stroke. Then how did the stroke come? Was it from hypertension? Was it from alcohol? Was it from hyperlipidemia, which is high cholesterol, and etc.? Or somebody has a heart attack. It's not always cholesterol. It can be alcohol, and it can be smoking. And in the near future, I'm going to do a video on smoking, because that's another deadly poison known to man. But the governments look the other way because it makes money for the society and makes money for the government. So they just have you label it and say, oh, it causes cancer, it causes heart attack, it causes stroke. But you can smoke if you want. And not to mention that alcohol is deadly for a pregnant woman. When you drink alcohol while you're pregnant, you might as well get a gun and point it at the fetus in your womb and fire, because there are tons of deformations, tons of illnesses that come from alcohol that impacts on the fetus. And then for those who drink, if you drink heavily, this is a warning that you can't stop drinking cold turkey. Meaning, you can't one day suddenly say, I'm not going to drink anymore. If you already know you are a heavy drinker, you need to see a physician to guide through the process of stopping what I call alcoholism. Because once your body is dependent on alcohol and you suddenly decide not to drink, you're going to develop what we call, you may, most likely, develop what is called delirium tremens, or DT. D as in dog and T as in Tom. And that can kill you. And not to mention alcohol withdrawal syndrome. If you are a heavy drinker and suddenly you don't want to drink anymore, and you stop, there's a chance that you're going to develop what you call withdrawal syndrome. Your heart is going to start beating fast, you're going to start sweating, then you're going to start acting bizarre, agitated. And if you're around a physician who has dealt with this multiple times, they're going to recognize what is going on with you. If there are no medications to give you, they should give you alcohol to drink, because that's a treatment. Because your body is used to alcohol, and now that you are staying away from alcohol, alcohol is saying, no, you can't go away. You need to come back. But if the physician has the medications that we use to treat it, there are multiple modalities we use. But the most common one is that we use benzodiazepines, such as Ativan. We give it to you. It may make you sleep. Even if it doesn't, what it does is it will act like alcohol in a sense, to tell your body, hey, alcohol is here when alcohol is not really here, until you gradually wean off from alcohol intake. I hope this helps.